Welcome to Canadian Justice. I'm Christine Van Gyn, and today we're talking about mandatory vaccination and vaccine passports for COVID-19. Vaccinations are a very important part of the fight against the COVID pandemic. Vaccinations are safe and backed by science, and I chose to get vaccinated, and I'm happy I made that choice. But there is some vaccine hesitancy in Canada, and a portion of the population remains unvaccinated for a variety of reasons. This has led some policymakers and politicians to begin talking about policies like mandatory vaccination in certain contexts and in discussions about whether domestic vaccine passports should be required. Now, for transparency, the organization I work for, the Canadian Constitution Foundation, is on record opposing vaccine passports, and we're actively considering legal challenges to those types of policies. Now, these policies can have legal implications that touch on our employment, labor, and human rights, and to the extent that they're mandated by government, our charter rights. Here today to discuss these legal implications is Danica McClellan, an Alberta-based employment lawyer, and Carrie Bowman, a bioethicist with the University of Toronto School of Medicine. Thank you both so much for joining me today. Now let's start with the issue of mandatory vaccination. Policymakers and politicians, at least so far, are talking about it in certain contexts, for example, in a medical context. Now, making the vaccine mandatory for healthcare workers and education workers, as an example, and the Prime Minister is also looking at it for federal employees or federally regulated workers. So, Ms. McClellan, let's start with you. Can employers mandate vaccinations for their employees?
Well, like any lawyer, it depends. That's got to be your first answer to anything. It's important to keep in mind there's a really big difference between a unionized workplace and a non-unionized workplace. So if you're in a unionized workplace, if you're an employer with a unionized workforce, the answer is probably not. If you're an employee in a non-union workplace or you're an employer with non-union employees, the answer is probably yes. And the reason for that is in a unionized setting, the employment contract essentially is the collective agreement. And if something is permitted or not for an employer to do depends on the language contained in the collective agreement. And with previous types of vaccines, arbitrators have pretty consistently held that an employer can't mandate employees to get vaccines under threat of termination, for example. In a context where there's no union, the employer is less constrained by what's in a collective agreement because there isn't one. So they're only bound by what's in the common law. And employers in those settings will have a bit more flexibility, particularly if they are making all the accommodations they need to for human rights considerations. And if they've also shown that they've developed a bit of a policy before just mandating vaccines.
Now, I think one of the things that's important here to acknowledge is that a lot of workplaces that are unionized are, in fact, healthcare workplaces. So, Mr. Bowman, let's look at it from a different angle rather than a legal angle. Do some types of work, for example, healthcare, create a different moral obligation than others that might require vaccination for those employees?
Yeah, I would say absolutely that healthcare workers, generally speaking, have an elevated moral responsibility. And, when it comes to the rights of healthcare workers, I have probably some insight and some bias here because I'm a healthcare worker myself. When it comes to that, we really do have to put the safety and well-being of patients first. Having said that, when we say mandatory, what is it we're talking about? Reassigned work? Frequent testing, calling security and having someone escorted out the door. These are very, very serious undertaking if we're going to make this mandatory. And look, I must say as an ethicist that it tears at the very roots of Canadian healthcare. That being the free and informed consent of the person, in this case, the healthcare worker. But I would say that, the obligation is there. But when we start looking at, teachers, I'm less familiar with that scenario, especially with children, in terms of an infection point of view. And then government workers, you see, these are very different categories.
They're very different, but what Justin Trudeau has proposed is it's federally regulated workplaces, which would include not just government workers, but for example, banks are federally regulated. So would mandatory vaccinations apply to bank employees? It's unclear to me what the Prime Minister is proposing here. Let's dig into this after these commercial messages. Welcome back to Canadian Justice, where we're talking about mandatory vaccination. Now, Ms. McLellan, you're an employment specialist. There have been a number of companies in the United States that have actually started to implement mandatory vaccination among their employees. Can you tell me how this has gone in the United States? What has the reaction been? And do you think it's something we might see in Canada?
So this is something that we've been watching very closely. Our firm, we do more employer side work, so we're always interested to see what other employers out there are doing. In the last 3 to 4 weeks, we've seen a number of really large American employers, including Amazon, Walmart, Microsoft, Disney, Tyson, which is a huge meat packing and meat supplier company. And they've started to introduce mandates, particularly with their executive and their office staff first. They haven't quite gone so far as to introduce mandatory vaccines for all of their frontline workers yet, but that they expect that's going to be coming in the fall. And I do think that Canadian employers, once they see American employers do it and they see American workers broadly go along with it, I think Canadian employers will be more tempted to look at implementing those sorts of policies, particularly as we get into cold and flu season in the fall.
And in your view, do you think that this causes sort of privacy concerns? Just briefly, because I want to give Mr. Bowman an opportunity to comment as well.
The privacy rights of employees are incredibly important, and that's going to be one of the biggest implications, one of the biggest factors employers should consider. And so if they are going to look at implementing these kinds of policies, it's going to be really important that their policy takes into account how to minimize the impacts on privacy rights. Including how they're storing that information, what information they're actually requiring, are they retaining it, or are they just getting confirmation from the employee of their vaccine status?
Now, Mr. Bowman, what can you tell me about mandatory vaccination requirements that already exist, in your opinion, in Canada or elsewhere, and your opinion on those type of mandates?
Yeah, well, certainly France has instituted this, and some people would say great success. They announced it, and people signed up overnight, 1 million people. They also had riots in the street, and so it does occur, but it can be very divisive. And I think one thing we have to remember as Canadians is, yes, we got off to a very difficult start with this pandemic, including vaccination, but we've rolled ahead. And one of the factors that's working for us is generally we have cohesion nationally in terms of how to proceed with this pandemic. We do risk that with mandatory. And the concern I have with mandatory is it's not one size fits all. It has to be measured. We have to show that other methods have not worked. And more than that, it's scientifically, I'm not suggesting it's not scientifically grounded, but we need to know that vaccinated people with only vaccinated people, that the risks plummet substantially. Do we know that yet? I don't know. People have different opinions. So, it's not just what decision we make, but how we make them. And one of the things that worries me in the Canadian situation, when we hear our Prime Minister speaking about federal employees, we could be in a situation where, someone in a bank has to be vaccinated. You have to show vaccine proof to go for a glass of wine on an outdoor patio, but a kindergarten teacher wouldn't have to be vaccinated. It may not be coherent at all. And that would be absurd.
Yeah, so that's one of the things that Danica raised, this conflict among unionized workplaces. And I've found it really interesting that there have been so many calls on politicians to impose vaccine mandates on certain types of employees, when I have heard mostly silence from the unions representing those employees. If anything, I've heard resistance. Danica, what can you tell me about the history of the unions and their position on mandatory vaccines for other things like the flu?
So historically, and the reason when I say you probably can't impose a vaccine mandate if you are in a unionized context, that's because unions have historically grieved the introduction of these types of mandatory policies, like you said with the flu vaccine. and even policies where there was it's called a vaccinate or mask. So either employees had to be vaccinated against the flu or they had to mask during flu season or during an outbreak. Even some of those policies have been subject to criticism by arbitrators. So you're right that unions haven't been coming out full-throatedly supporting vaccine mandates. And that's because they know that they will likely be in a position where to be seen by their members as promoting their privacy rights and defending their interests, they're going to have to start breathing these policies as well.
Now, let's get into the question of vaccine passports, a totally different but related issue, when we come back from this commercial break. Welcome back to Canadian Justice, where we're talking now about vaccine passports. And Manitoba has imposed a vaccine passport. Quebec is now contemplating one as well. Now, Mr. Bowman, one of the things that I find interesting is that when politicians and sort of policy people talk about vaccine passports, they're not just talking about it as a safety measure. Sometimes they talk about it as sort of a pressure tactic, a stick rather than a carrot, used less about stopping the spread of the virus and more as a way of compelling the remaining unvaccinated population to get the shot. Is one of those purposes more justifiable than the other from sort of a moral point of view?
Yeah, I mean, from a moral point of view, the safety and well-being of the broader society is absolutely the goal. And one of the things that concerns me, particularly in recent time, is this is becoming an increasingly political and emotional debate. And so what I sometimes wonder, is this a way of sort of pushing this kind of angry debate to make sure people do what we want them to do, rather than a really measured epidemiological position? So that certainly is a concern that I would have. And have we tried everything else? We don't know. We have, but this country is massive geographically, and there's areas where I suspect there's plenty of Canadians that simply haven't had the opportunity to be doubly vaccinated as yet.
Now, Ms. McClellan, I want to ask you about your reaction to vaccine passports, because some of them, for example, Manitoba, when it was first introduced, and I haven't reviewed it recently, but there doesn't appear to be an exemption in the Manitoba policy, right now at least, for religious objections or medical reasons. So a person who has a disability that precludes them from vaccination. What's your reaction to that part of the question?
Well, I think if governments are planning to introduce vaccine passports, and if they haven't thoroughly considered, the different exemptions that are going to be required to meet human rights obligations, I hope those governments have fully staffed up their human rights commissions, because I suspect they'll be busy. But there's also likely going to be charter challenges to any kind of legislation imposing those mandates without reasonable accommodations given as well.
So, Mr. Bowman, let's turn to the question of the actual rate of vaccination in this country, because Canada's been quite fortunate with voluntary uptake. I think we're at over 80% now has our first dose, over 60% has a second dose. Is there an actual scientific rationale for a passport system when there's only a small part of the population that remains unvaccinated? And we're learning now that the ability to transmit even if you're vaccinated still is possible.
Yeah, no, it is possible. It comes down to this, the variants with Delta leading the charge. If we had the original COVID-19 that emerged in late 2019, early 2020, I think all this nightmare would be winding down by now, but we don't. So to answer your question, I think no one is completely sure what herd immunity is going to look like from a numeric point of view. And the number has been rising over the last several months. People are now saying 90%. And I think there's a bit of panic, because we're not sure how serious a threat Delta is. It's clearly a threat. I don't take that lightly. But how much of a threat, we're not sure. And there's a lot of anxiety about a potential fourth wave. But, anxiety and threat and emotions are not great ways to make good decisions that are scientifically grounded.
Danica, this hasn't been talked about much yet, but the idea of a vaccine mandate for large groups of the population, like federally regulated employees, how far do you think we are from a policy being proposed that there's mandatory widespread vaccination for the entire population?
I don't think we're anywhere near there. I would be quite surprised. I think before we got to that stage, I think we would want to see governments, testing out how smaller vaccine mandate rollouts went first. I think from an effectiveness standpoint as well, encouraging people to get vaccinated is going to be more effective. And to Carrie's point, is going to promote, social cohesion a lot better than these sort of widespread mandates would, which I think would be subject to an immense number of legal challenges from all corners of people who have challenges and objections to that for different reasons.
Carrie, we've only got about 10 seconds. Your reaction to the potential of a widespread mandate?
Yeah, I'm not big on one size fits all. Good ethics is based on good science, and it's not just what decision we make, but how we make the decision. It has to be more nuanced than that. And I think we run the risk of some really negative social pushback, which will work against us in this pandemic.
We'll be right back. Welcome back to Canadian Justice, where we're talking about vaccine passports and mandatory vaccination. Now, Ms. McLellan, what is the point of a vaccine passport for, say, a restaurant if there's not also a vaccine mandate for the employees? How do those two policies intersect?
That's going to be an important question that any government that looks at imposing legislatively a vaccine passport system or vaccine mandates. I know in New York, in New York City, I believe their policy is going to be for, at these specific locations for any customers or employees. So employees will also be subject to that same broad requirement, which I think raises a lot of questions about, are we then forcing people who can't get vaccinated if there are no exemptions? Are we forcing people to quit their jobs? Which, to Carrie's point about one size not fitting all, that it's a good point that employment is a little bit different than not being able to go get a glass of wine and having to pick a different restaurant. It's harder to just pick a different job.
So, Carrie, one of the things that I've actually been hearing from even prominent pollsters is that the majority of the population, and it's a pretty significant majority, supports vaccine passports. Do you think that should weigh into the policy-making, decision-making process?
Well, yes, because, we live in a democracy, but no, because, the question is so broad. And, asking people what they think on a survey instrument, as we've just talked about throughout this good interview, there's many more nuances than that. So I question, I question the data to some extent. And so it persuades me somewhat, but boy, I'd much rather have a conversation with people as to what they think than seeing the results of a survey instrument where it has not clearly defined what it is we're talking about.
Yeah, and certainly majority rule does not always result in minority rights.
Yeah.
So, Ms. McLellan, I want to ask you another question. What have you been hearing from businesses and employees, and what advice do you have for businesses or employees who are dealing with these issues right now?
So we've heard from a lot of employers across the country who are interested, they're curious, they want to know what they can do. Most importantly, they want to know how they can do it in a way that they're going to bring their employees on side with them. Because no employer wants to deal with a bunch of employees quitting. I know lots of employers are already having staffing challenges coming out of COVID. So employers want to make sure that whatever policies they're going to introduce, they're going to keep their employees safe, they're going to keep their customers safe, but they also want to keep their employees happy. Because if they don't have employees, they can't run their business. And so for employers who are considering vaccine policies, it's going to be very important that they seek out a qualified lawyer who can help them, who has some experience with these issues, because there are also WCB concerns, there's occupational health and safety issues at play, there's a union, non-union distinction, there's human rights. So it's a very complicated, nuanced question. But it's also the only question that we're getting these days.
And employees, if they're dealing with this issue, should, of course, always consult an employment lawyer for specific advice. Looks like we lost Carrie, but Carrie, thank you so much for joining us, and Danica as well. Thank you both. Thank you so much for coming on the episode and talking about this really important conversation. There's a lot of nuance, a lot of legal issues that intersect, and I appreciate you coming on and sharing your insights so much. We've heard today about mandatory vaccination and vaccine passports within Canada. Now, I support vaccination and I'm vaccinated myself. And I think vaccination is a wonderful scientific development that has literally saved millions of lives. And I think there's a lot of misinformation about vaccination, and I will not contribute to that misinformation. But it's totally consistent to support voluntary vaccination and to oppose government-mandated vaccination and vaccine passports. We want to avoid bureaucratic overreach that requires us to show papers to travel within our country or to engage in our day-to-day lives. We want to accommodate minorities, like people living with disabilities or who have minority religious views or beliefs, even if we don't agree with those views. That's the point of a liberal democracy. If minority rights were granted on the basis of public opinion, they would not exist. But what do you think? Do you support these policies, or do you think they violate our fundamental rights? You be the judge. I'm Christine Van Geyn, and remember, a freer Canada starts with you.